Here's a message from today's episode's sponsor. Long-term care pharmacies are always on the hunt for ways to scale their business and ensure they're a solutions partner for their nursing home and skilled facility customers. Now, with the aging baby boomer generation projected to increase the number of Americans ages 65 and older from 46 million to more than 95 million by 2060, the demand for long-term care has never been greater, and neither have the growth opportunities for LTC pharmacies. Framework LTC is a long-term care pharmacy software designed to improve scalability. This platform is incredibly effective for scaling your LTC pharmacy business. It starts with your workflow management, designed around your operations. Framework LTC was designed with long-term care intricacies in mind, which provide a number of different features unavailable with a retail pharmacy software. Framework LTC helps to accomplish these 7 critical categories: streamlined workflows, automated manual tasks, custom services to meet unique needs of different facilities, gain better visibility into your operations, make data-driven decisions, curb your billing complexities, and manage new services. Learn more at frameworkltc.com. That's frameworkltc.com.
You're listening to the Pharmacy Podcast Network.
This is the Sex PharmD podcast with your host, Dr. Nadia Archambault, licensed clinical pharmacist and certified sex therapist. With a focus on women's sexual health and wellness, Dr. A is here to cover important health topics and answer all of your questions about subjects that can be applied to pharmacy practice. And now, here's Dr. A.
Hi, and welcome to another episode of Pharmacy Podcast Network's Sex PharmD. Welcome back. Today's guest I have is a concierge pharmacist. She goes by Dr. Sue, and you're definitely going to enjoy listening to this one. Hi, Dr. Sue. Welcome.
How are you? Thank you for having me.
Well, thank you for coming on here. And you do so many really interesting things, and I love that you go by concierge pharmacist. So tell us a little bit about that.
Oh, thank you so much. I really appreciate it. And first off, I just have to say I'm so excited for our conversation and for being on this platform. I think it's super cool what you're doing, especially in this space and the topic. It's such a very taboo topic to discuss, and I love that you're able to champion this area and you're so comfortable with discussing it. So kudos to you.
Oh, thank you. It's fun. I have fun with it.
So you said concierge pharmacist, like right before our discussion, we were trying to figure out my role. And I guess I have many hats right now, but the main one would be concierge pharmacist. I have a PGX practice where I see patients or clients individually and help with PGX testing. And I also have collaborative practices with physicians as well, where I implement PGX services there. And recently, I just published a children's book. So that's my newest project I'm working on, and that's the one I'm super excited to tell you about.
Yeah. So the book, I know I've seen some of it on LinkedIn, and you know what? Just to rewind a little, for those of our listeners, most of them know what PGX is, but what does PGX mean for the listeners that don't?
So PGX, pharmacogenomics, it's a really long word that I had to learn the definition of.
Yes.
I don't know how to say it, because it is a very complex topic, but it is something that's so important and vital to the way we practice in pharmacy and, prescribe medicine. And I'm really, really excited to explain that. It's basically using your genetics or using your genetic makeup to help clients get the right medications based on that information. And working in retail pharmacy, I've seen so many patients go through so many different changes in their medications and their regimens based off of cost, trial and error. And I saw such a need for this to be implemented into service. And it's a necessity that I think that should be a part of patient care, and giving this opportunity to patients and having prescribers use this technology is really, really new type, very important in prescribing.
Yeah, it definitely is. And it's still fairly new. I did the training myself. It was pretty involved. It was hard. And as far as medication therapy management for patients, this is definitely on the cutting edge of medicine as far as I'm concerned. And it's amazing that us as pharmacists can be a part of it,
I mean, it seems like a very difficult topic to understand or grasp, but being pharmacists, we are able to understand and see how these medications are relatable to patient care, because we study all this in pharmacy school, or it's embedded into our studies, but it just has a specific name or a course, PGX, pharmacogenomics, and we're very familiar with it. But diving down deep into what exactly it is, it's basically our bodies are different, right? We have different genetics, we have different DNA, and we break medications down differently. No two person is alike, and you could metabolize the medicine one way, I'll metabolize it differently, and that would in turn have a different effect on how we break medications down. So knowing this information ahead of time, along with other factors, physicians can help tailor medications properly and give them to patients and have such a greater outcome in patient care.
Absolutely. So what prompted you to get into this? Where did you start your pharmacy career? Most of us are not doing anything that we started doing, now.
Right? How changes and the path just becomes from, it's no longer A to Z. It's like all between ups and downs. But, you just have to be very receptive to what's your surrounding, what you're practicing, what you like in your field, or what you see that there's a need for a change. And using that information, I started off, majority of my career has been in retail pharmacy. And, it has its rough days. I mean, there's difficulties in every areas of any type of work force, but retail pharmacy particularly, I actually liked it. I liked the craziness. I liked the changes. I liked the customers, and it was difficult at times, but I just managed, and I just kind of just went along the flow and just said, this is, I guess, life, or just you just have to deal with it, right?
I don't know if a lot of people would say that. You also have several children, correct? So you're used to organized chaos, I would imagine.
I guess maybe that's helped along the way. I have 5 little ones.
Yeah.
And I guess I became numb to like all the things that were going on in pharmacy. So that definitely helped in preparing me to deal with all the craziness there. But towards the end and towards COVID and that just happening, it really shined the light in the patient care. And I said, if I want to be the change in pharmacy or want something different, either I could complain about it or just start something and do something differently. So I started off and I created a platform and Pharmacy. And I started posting a couple of videos, just educational, a couple of different definitions, basic pharmacy terms like refills, what's a prescription, insurance, very basic. And it was starting to get traction. I was getting lots of feedback from the sources I was posting online, mostly on Instagram, YouTube. So I took it a bit further and I went a little bit deeper into explaining like what is pharmacogenomics, what is PGX, and explaining complex topics like that. And I was getting a lot more questions, and it was growing, and I didn't expect it to. I just did it for fun. And towards I would say early last year, 2022, I was recognized for being a pharmacy influencer. And I guess it just spiraled from there, like one after the other. And getting that recognition and being appreciated by my customers and clients, colleagues, that was a tremendous gratitude I felt. So I said, it is being acknowledged and is being recepted by so many different sources. I might as well build something from this. So I just took it from there, one step after the next, and I love it. I love how it's changing. Every day is a different day. I feel like you make it your own, and you see a vision in something, and you just grow from there.
Yeah. And I love that. No, I think it's awesome. And I love that you have a good amount of followers. You've got I saw you have 28,000 or something like, I mean, that's a good amount. I mean, I feel like pharmacy is not like something people are always interested in or looking up. You have a good following. That's awesome.
It's funny. I went to the grocery store the other day and I was shopping online. I noticed the cashier, she was looking at me and she's like, "You're Dr. Sue." And I'm like, "Oh," I'm thinking, do I have my name badge on? Do I have something on that says who I am? And she's like, "I saw you online." And I was like, "I follow you. And your content is so cool." And I it was like at that moment, I realized okay, it's in the public world now. It's in the eyes of the public. So
it's so cool.
Getting, outside recognition, but I'm not doing it for the recognition part, just the education part, because sometimes these things that us as professionals and being in this pharmacy, we think that the information that we know is so common or, everyone knows it, but not everyone is aware of all these health topics. They're not questioning what their doctor says. They just call, like when we get those questions, like the patient calls and says, "I want the refill for the white pill or the yellow pill." Like no one even knows what medications they're taking or what it's for, or what side effects what could they do to get themselves to a better place. But it's just more patient advocacy and patient care. So those are my biggest things that I educate patients on, and understanding their use of their medications, because it's so important that you understand that.
Absolutely. And you're reaching patients through social media. I mean, it's the way to do it now. It's fantastic.
That's great. That you never think of before that would be something that you'll be interested in, but it's the coolest thing. So, there's different platforms. Each one is tailored to different clients and ages. And there's LinkedIn, there's Facebook, Instagram, TikTok. And it's funny, you see one person on one platform, they have different content than the other. So it's changing.
Yeah.
Able to suit different needs. So
it's great. So getting into the pharmacogenomics piece, and how it can apply to sexual health. I know that, for one example, some people are on antidepressants, and I've seen patients who are on antidepressants because some of, their sexual health is affected by their mental status, of course, So explain to our listeners how some of this can be implemented as far as the pharmacogenomics piece and what you've seen in your practice as it affects medications used for sexual health.
That's a great question. I mean, you'll be surprised the amount of antidepressants that is being prescribed in the retail setting, in a number of different settings. Many patients are on antidepressants, and not many of them are on the right antidepressant. And that has such a big implication as far as drug genome interactions. If you're not on the right antidepressant, that would cause many side effects. You'll have a number of different things it would have interactions as far as knowing which metabolism that you fall under. If either you could greatly be a slow metabolizer, you could be a fast metabolizer, which would in turn either produce higher concentrations of the medicine in your body or lower concentrations. Maybe the medicine might work for you, or maybe it won't work for you. So if you're going to have an overdose or higher concentration of the medicine in your body, you're going to have side effects, and side effects would in turn cause a lot of sexual health concerns. Decreased libido, there's erectile dysfunction, a number of different things that would be impacted by that, definitely.
Yeah, like some people have high anxiety, so they're on an antidepressant also to help with that, and that affects their, it can be performance anxiety even with some patients. And, the female sex organ, I always say, is the brain. It starts there for women. So, and this is interesting because sometimes antidepressants can help, but then other ones, like the SSRIs, can lower, they can decrease libido. So it's important to know what kind of metabolizer they are. So for those listening, if you're a fast metabolizer, you're going through the drug quickly, if you want to put it in those terms. And so you need a higher dose, correct?
Yeah. And you wouldn't
So,
think
yeah.
that a person, like for example, one person might need 100 milligrams, but because of your metabolism rate, you might need 200 milligrams. So knowing this information, or at least a snippet of understanding this ahead of time, prescribers are able to adjust your medications and therapy. So it's a great insight into knowing how to dose medications as well.
No, that's so true. And then, as far as contraceptives, so hormonal contraceptives for women, it's very interesting how that can, just the testing, the PGX testing, pharmacogenomics testing can help identify those genetic variations that may affect how they metabolize that.
Of course, yeah. That's another great point. I mean, it all plays a part. It's no longer just one system review. It's no longer just I'm going to see the heart doctor and just deal with all cardiac side effects or treatments and just keep it separate. It is not going to interact with this other system. It all plays together. All your systems are connected. So you have to put the entire puzzle together and look at everything. So it's interesting how everything works and falls into place, right?
Yeah. So, I mean, depending on what kind of metabolizer someone is on a hormonal contraceptive, they could be at higher risk for blood clotting, right? If their levels are much higher, and that could be dangerous for a lot of women.
We see that so commonly with contraception. So, I mean, different cases, there are other predetermining factors, but that does play a great factor in determining those drug genome interactions there for sure.
Now, on the male side, have you seen anything with testosterone with PGX testing?
Yeah, same thing. It falls under, I mean, they're all hormonal.
Yeah.
So it definitely plays a fact in determining that as well. So all of that plays, it all comes together, and, having lower libido, there's going to be energy, different.
I mean, I know erectile dysfunction medications. That's another one, that's important for. And then, if there's too much in the system, it can cause, if I remember correctly, the headaches, vision changes, that can be a factor also. So as far as when someone gets the testing done, explain how it goes from start to finish. So a patient's doctor orders blood work for them to get the test.
So it's actually very simple. And to think that it's not that complex, let's put it this way. We all went through, or most likely have done, a COVID test. It's way simpler than that. You would have, the doctor would order the test, or the pharmacist, depending on who you're working with. And it's a very simple process. You would swab the inside of the mouth, collect the sample, send it back to the lab, and you'll most likely wait around 7 to 14 days, and the results will be sent back over to the practitioner. And you have about a 20-something page report that it turns back. And that's the fun part, where you go through all the information, dig through all that information and just decide how to plan accordingly and come up with a care plan for the patient. So that's the entire process basically there.
Yeah. So you review that lab report, correct?
Yes.
Okay. And then do you do a call with the patient to go over that, or do you do a call with the prescriber?
Depending on what we decide in the beginning, either we could do a call to patients. I would give information to them, or if they want more of an in-depth care, I would reach out to the physician and have a care plan determined there for them as well. And most of these are done remotely. There are some patients who are preferred to do face-to-face, but like with telehealth and everything moving to that direction, it's mostly remote.
Isn't that great? Cool. It's so great. It makes it so much more accessible for people.
Right? It's changed the world of medicine. Make it very convenient for everyone.
Absolutely. So you offer these services as an independent contractor? Are you, and I saw on your website, and you also are able to train any type of pharmacies or pharmacists on how to do this?
So what I do is if I choose to do it independently, it would be just concierge services.
Okay.
So clients will reach out directly to myself, and then we would set up a contract depending what their needs are. We would go over a discussion and see what they're looking for. Either they want just overall health or wellness, or we have to define their needs because they have to have their understanding of what their determination of health is. And once we determine there, we would just either go forth with discussing their medications and how to use them properly, correctly, indications, what is each one being used for particularly. And if it determines at any time, then we would go further to do a PGX testing.
Awesome.
And if they want, we could also provide information to their physician and maintain a constant communication to determine where they're going to end up as far as therapy.
Mm-hmm. Oh, I think it's great. I mean, you definitely take a holistic approach to everything. I see you do functional medicine in addition to the pharmacogenomics. It's fantastic. As far as sexual health goes, have you had any patients that have come to you with questions on how to help them, maybe like some type of supplement or nutrition program?
That's actually one of my underlying, I think they don't come out directly saying this is the concern, because not everyone is comfortable saying that this is what I'm going through. I have low libido, I have trouble in XYZ or whatever the case may be. Not everyone's comfortable discussing things like this. So being a pharmacist and being able to be connected or comfortable with your patient-client relationship, you determine through discussions that what's going on with your client. So the main population that I do see are patients who are on antidepressants, who have anxiety underlying conditions in that disease state. And you use your clinical judgment and you notice that they're suffering because they're not on the right therapy, or they're going back and forth, or they're being over-medicated, or whatever was going on, because there's so many different reasons. And we have to use our knowledge and clinical judgment to see that what is going on with your patient and how to help them. Yeah,
no, it really is. It's so important. And I love your motto you have on your website. It shouldn't be a pill for an ill. That's great. It's true.
So like, especially in retail, someone would come up to you and they would ask, I have a headache, and they wouldn't leave, or they wouldn't be comfortable just going through or understanding that not every symptom needs to be treated with medicine. Could it be that maybe you didn't sleep, or you didn't eat, or whatever it might be going on, or you're stressed about something? But some patients, they feel so much more comfortable knowing that they're going to take something, but it's educating them that there's other ways that you could understand and treat yourself without medicine. And my techs used to laugh at me when I was working that I would always recommend ginger ale to my patients. And I was every time they would come, the ginger ale will be sold out because everyone's buying that for curing themselves. But a lot of our symptoms or the things we're trying to treat is you're able to take care of that, and just with doing a couple of minor changes or adjustments to our day-to-day activities.
Yeah, no, and we see that so much with patients where mental status is so important, and I think it gets overlooked a lot. And there's always, they figured they'll just take a pill for everything, but there's so many other things you have to do to get back there, and in COVID, I've seen there's so much, I feel like it just increased anxiety for a lot of people. People were alone, isolated, and it really took a toll mentally on a lot of people.
And it doesn't help too with our society just being very geared to driven to always want instant gratification or want an instant fix. Not everything is going to be instantly taken care of. Sometimes there's a process, and understanding how your body works and getting your patient to be understanding of that and aligned to that will definitely help. So that's one of the things I'm greatly stressed with my clients when I work with them.
Yeah. Now, as far as resources go for anyone out there who's interested in pharmacogenomics, and what are some good ones for you, and where did you do your training?
Oh my gosh. I definitely, there's so many interesting, information out there, but knowing we technically have all the information we need, as pharmacists going through pharmacy school, this is part of our course and our curriculum. We went through pharmacogenetics, pharmacodynamics, so we know this already. But one of the greatest, I can't rave enough about this, but I took PGX 101 with Sue, Paul, and Dan, and that was an amazing highlight to giving you information and factual, like in-depth information through the University of Pittsburgh. And that was a really amazing course. And then I went further. I went and I did the PGX Confidence Academy with Jamie Wilkie. That was like light bulbs just keep going off every time I would go through a next section or a different course, a module. It was amazing. I absolutely loved that course. It was just the pharmacists that I met through there, they've been super helpful and amazing. And they're doing so many different things I would never even think about doing, but they're owning this space and creating so many opportunities within it and just shedding light that this exists and that you could definitely create something and build out of it because of your passion and your love for helping patients ultimately, right?
Yeah.
So those are definitely the ones I see. There's many other programs out there. There's master's programs if you want to go further and just go really dive deep into it. But those were the two that I personally have taken and I love.
That's cool. That's cool. Yeah. And I feel like there's a lot more out there now for pharmacists with the training, which is great,
Yes. I mean, like I said earlier, you could either complain about not being happy where you are, or you're just going to look for an opportunity to exist and create a space for yourself. Because if you don't do it, you're just going to sit on that idea and just let it go by. And just I always wonder, like, what if, or could this have worked, or maybe this would have worked. And when someone else comes up with it, you're like, wow, that's amazing. That's great and wonderful. And I've particularly seen that with the many things that pharmacists are doing in our space. And it's funny, we had a recent article come up with a pharmacy shortage that was published all throughout. And I think pharmacists everywhere were so upset about that. I remember reading it. I was like, absolutely, like seriously, there's no pharmacist shortage. There's definitely a lot more pharmacists realizing that we have so much more potential in areas that we could focus on helping our patients. So it's not always in the typical settings like retail and hospital and like the ones we're very commonly used to. I saw
that article too, and it made me so angry too, because there was a time where you couldn't get a job. It was like waitlisting for retail pharmacy. Now, you know what it is? It's not that there aren't enough pharmacists. They just don't want to work under those kinds of conditions until they change the conditions of retail pharmacy, and the pay hasn't gone up since I've seen it going down since I've graduated in like 2008, and no one wants to deal with it anymore,
I mean, it definitely does make a very interesting topic of discussion, but I think there's a lot more education based that has to come out from it, and more of like shining a light in the public, because not everyone is familiar with that. They just see one thing and they see all the stores closing. They see the long lines, like, oh, there's a pharmacist shortage. So it's very misleading. So I understand where the public would get this information, but we definitely need to build our platform and just understand and recognize the other pharmacists out there who are doing so many amazing things and able to own their space and creating so many opportunities that we never thought existed.
Yeah, no, absolutely. So, I know that you also, you're focused on holistic medicine and functional medicine. Explain to me what your version of functional medicine is, because I've seen this everywhere, and I feel like there's so many different areas of functional medicine. So what is it? What is it exactly? If you can clarify for our listeners.
Like you said, everyone's definition is very different. There's no true school of functional medicine. And sometimes it gets lost in the definition and no one really wants to touch it because of the ambiguities of it. So it is often left to misinterpretations and up to one's interpretation of it. So my particular way I would define it is finding the root cause of the medicine, the root cause of the illness, and treating that without just throwing medicine onto everything. Like just, oh, this is going on. Let's find a pill for this. So let's find something to throw on and just add to your regimen. So that would be my basic under definition. So finding the root cause
Okay.
of an illness and treating it. And
and I know a lot of people are like gut health. That's a big one, but yeah.
And
okay.
gut health is very, very big. Like that surprisingly stems and roots from all things. I believe that once you have that under control, a lot of ailments and problems would definitely be under control, or definitely under control there.
Yeah. Mm-hmm. Oh, so interesting. So I know that you mentioned your book earlier. Tell me about your book.
So the book came about, one of my other friends who's also a pharmacist, and she did the PGX Academy as well. She wrote a children's book. And when she mentioned it to me, I thought it was a cool idea. Like that's so different. Like you're writing a children's book and you're a pharmacist.
Yeah.
And her topic was on like healthcare heroes, and it was around the time of COVID. So it was definitely nice to see that and see her work in a project. And, the wheels are starting to turn, of course. And I mentioned it to the kids and I said, guys, my friend just, did a children's book and they loved the idea. And once I saw how excited they were like the inspiration behind all this. It started off last year, December. And I remember mentioning it to them and I saw the excitement. And it was around Christmas when I told them that I'm going to gift you guys this and we're going to work on it together, and we're going to build it from then. So I said it. So once I said it, I have to get it done because it's out there now. It's in the universe. I said it. And I'm not joking. From the time I mentioned it, from December all the way to right now in March, it just completed itself. I just made sure that I had to work on it, get everything formatted, from the storyline, from the illustrations, from the print, publishing, everything. Yeah. I made sure we put all of our energy into getting this completed. And I think it turned out pretty cool. It's like, bright, colorful illustrations. And the fun thing is that it explains PGX in very simple terms where children and adults could understand it, because if
that's so cool,
we could understand it, I mean, anyone could understand it. So I kept it very simple to a fact where kids could understand the concepts of it. They're not going to go into like very in detail stuff with the cytochrome P450 and all that. But it just briefly touches on genetics and understanding that we're all individualized and we're all different and we're going to respond to medicine differently. And that's the basic concept of the book.
I think it's a great idea. Now, did you publish it on Amazon?
I did. Self-publishing.
Awesome.
It's so simple. And surprisingly, I was able to get so much help from Amazon itself. Like if I had a question, you just reach out to them and they're so helpful in the whole process. And we were mentioning before too, Fiverr was another great help. There's so many independent contractors out there, people looking to do gigs or have such amazing talent. You just have to find the right person, click and explain your vision and idea and go from there. That's how I found my illustrator.
I was going to ask you that. How did you get the illustrations? That's awesome.
Yeah, I'm not a drawer, so I can help there.
No, I think it's great. And you can share with your kids,
Yeah. Mm-hmm.
And when is that coming out?
So it's on pre-order.
Okay.
I started off I kept it for 1 month of pre-order from February 20th and available for sale on March 20th. So it's going to be available for purchase, paperback, hardcover, ebook, electronic after March 20th.
Awesome. And we'll put that in the show notes too for our listeners that are interested. I think it's such a great idea. Love that. So not to get a little, super personal, but you have 5 children, you said.
Yes.
So
I'm an only child.
Oh, okay. What is your secret to bouncing back as a woman? Your body's going through all these changes, sexually feeling different, hormonally feeling different. What do you recommend? How did you do it? That's a lot of children.
Always hear of postpartum depression, and you hear of these common things that women go through, and you don't really understand it. I mean, you do understand what it is, but going through it and knowing how your hormonal changes have to get readjusted after giving birth and having a child, it definitely exists. Like there's so many mood changes or fluctuations that you have to go through. And I saw something, I read something where everyone is so excited to see the baby. Everyone's so happy the baby's there, healthy, happy. That's all you want when you have a child. But things you have to focus on are just remember the mom. The mom went through so much of a change and drastic life-changing and life-bearing and birthing a child that you have to make sure mom is okay and focusing on getting mom back to be safe before. So that's definitely, you have to take time out of your schedule and take time to just rejuvenate yourself. And there's nothing wrong with that. Self-care is definitely something that's important. And that's nothing that anyone should feel guilty about doing. So
it's, yes. Thank you so much for saying that, because it really, really is. It really is.
Yeah. And, even if it's like quiet time or just by yourself, give the baby to your mom or your husband or someone, caregiver, to hold. So you can just have a little quiet time. It doesn't have to be long, maybe about half an hour, 10 minutes. You just need some time to just de-stress, just gather yourself and just focus on yourself. Even a warm shower. That was one of the things I used to look forward to, like after the, like the warm shower was my luxury moment. So I would enjoy the longest warm showers. And surprisingly, getting back into your mood, exercise was definitely one of the biggest. You just, all the energy and the tension, you would just, whenever it's safe to exercise after having babies, that was just the great stress reducer for sure.
Yeah. I mean, they definitely need to do more mental health checks with women who've given birth, not just the OBGYN.
The regular checklist. Yeah. And just answer these questions. And then you feel a little awkward too, sometimes putting down that you have certain thoughts, but just listening, having a person there just to talk to, just having a friend over, just doing laundry or anything that you could do to help out would definitely be so supportive in helping mom get back to normalcy, right?
Absolutely. I agree. Thank you for sharing that. I always like to do this during my episodes. I do a top 3, but I was trying to figure out what to ask you for your top 3. I guess it would be, what are your top 3 tips for as a holistic pharmacist? It can be to patients or other pharmacists, healthcare providers, as far as what you like, maybe products you like to recommend or lifestyle,
Yes, I would definitely say advice-wise, ask questions. Never be okay with just what someone as a healthcare professional or provider gives you. Take in that information, let it be take it in, be receptive, but ask questions. That way you're comfortable understanding how your health is going to be affected. Because if you understand how you're going to process certain things that you're going to be doing to help get yourself better, if you're understanding what you're doing and why you're doing it, it's going to work a lot differently. It's going to be successful. So not just blindly doing something just because someone tells you to do it. Understand why you're doing something. And patient advocacy is one of the most important things I see that's missing so much. And it's harder nowadays, especially with our older generation, because they're so trusting of their healthcare professionals. And that's fine to be trusting, but just understand that it's okay to ask questions. It's okay to understand why certain things are being done, why tests are being ordered, like why you're given this medication, why not another one. And I mean, to a point where it's understandable, but not confusing to a patient. So finding that right balance and having that connection and understanding how each person thinks, it's a very touchy area to dive into, because it's not easy to do in the common settings. You're not able to do it through a drive-through window or the 5-minute conversation you could. So I feel like when you're able to have these type of connections, you gain their trust. And I have many of my patients all the way back from New York. I'm still connected. Somehow they we all find each other, or we find
I
someone
love that.
connected. And it's really sweet because you go through life and you think that you left an impression in someone, and knowing that what you said to them makes an impact in their life, that means so much as a healthcare professional. And it's really an honor to be able to help patients in that way, for sure.
Oh, I love that. That's great. And what a great message.
Yes, thank you.
Yeah. So as far as everyone finding you, social media, website, how to get in touch with you?
So I have my website, pharmacy.com. And I'm on all social media platforms. I have Facebook, Instagram, TikTok, surprisingly TikTok too, which is pretty cool. It's not only for the young ones. I have LinkedIn. Professionals, I highly recommend professionals, or even anyone just starting their career, go on LinkedIn, because you'll find so many valuable resources there.
Isn't it great? It's like the Facebook for professionals, basically. I love it. It's great. That's how I found you. You honestly could just reach out to anyone and ask them a question, and they'll give you their honest feedback or help. And surprisingly, or not surprisingly, people are very helpful. If you're honest and true to what you're looking for, they'll be willing to help you and getting you to what you're trying to build or trying to come up with, or ideas. So it's definitely been a game changer. I love LinkedIn. Yeah, I know. It's great. It's really built up a lot too.
Yes,
for sure.
So many different outlets that you could go through, and it's constantly changing and growing.
Yeah. And then your Instagram, PharmaSue. I love the name too. It's so easy and it's fun.
I love the pun. That was a late night. I figured that one out. So I'm I'm going to go with it. It sounds very, very corny, but it works and everyone remembers it.
Oh, I love it. That's great. And then your book comes out the 20th of March. Okay. Yeah. And they can get that on Amazon.
Yes. And so with that, someone was asking me too, is that the end of it? Or are you going to think about doing something else? Is this the end of the writing era? So I'm considering maybe doing a series where I do other topics, and why not explain other very, very harder topics in a simple way. So that's in the works. We'll see where that gets.
Yeah. And it's called the Pharma Heroes?
The Pharma Heroes.
Pharma Heroes. Love it.
Yeah,
great.
Heroes.
Awesome. Well, thank you so much, Dr. Sue, for being on here. It was really great talking with you, and I hope our listeners gained a little bit more knowledge after today's episode.
Yeah, I appreciate it. I had a lot of fun.
Great. Thank you.